When you understand your treatment better, it can help you be prepared for the expected and the unexpected side effects that can limit your ability to eat and drink as you normally would during your cancer treatment. Thanks for joining me today. My name is Amber. I'm a registered dietitian, a cancer nutrition specialist, and an online nutrition coach. Adequate nutrition, or getting enough to eat and drink during your cancer treatment, can greatly improve the chances of you getting all of the chemotherapy and the radiation therapy that you have scheduled. So in order to do this, we need to be able to meet a total calorie, a total protein, and your hydration goal. When you're able to meet those goals on a consistent basis, you're able to maintain your weight and your lean body tissue, which in turn really helps to reduce the amount of fatigue that you experience during treatment. It can also really help support your immune system and improves the tolerance to treatment that you actually have, which does make it easier in turn to get those full doses of chemotherapy and radiation therapy that is scheduled for you. Let's talk about the two most common types of cancer therapy, chemotherapy and radiation therapy. Let's start with radiation therapy. IMRT is usually used to treat solid tumors located close to critical organs like your heart, your lungs, or your spinal column. A lot of times, IMRT is used to treat cancers in the head and neck region, in the breast region, along the GI tract. So if your medical team is using a different sort of radiation treatment, this information may not exactly apply in your situation. Let's talk about 3 different factors that affect the way that the radiation will affect your body. The first factor I want to discuss is that the effects of your radiation treatment will actually increase over time. So this means that the side effects from your radiation do not start right away. In fact, most people going through fractionated radiation treatment, or where you have one radiation treatment, let's say Monday through Friday, for 5 to 7 weeks, will experience these kind of side effects starting around week 2 or week 3. So this is because the radiation has a cumulative effect, which means that the radiation builds up over time. Now this is something very important to remember, because at the end of treatment, the side effects just don't go away. In fact, expect to feel your absolute worst from treatment the first week after you're finished. The second factor I'd like to discuss is how radiation is a location-specific therapy. So this means that the organs and the body structures that are located in the treatment field will be affected. So let me give you an example. So with the tonsil cancer, chances are radiation will affect from about here to about here. So I know all the body structures that are in this area will be affected by the radiation. The last factor I'd like to discuss about your radiation therapy is that the dose matters. In general, the higher the dose of radiation, the more intense the side effects you should experience. Now let's talk about chemotherapy. So chemotherapy and the side effects from chemotherapy are based on the type of drug and how often you receive them. You should have a teaching session with your medical team or members of your cancer team about the side effects that are common with the type of chemotherapy you're receiving. So I certainly hope you found this video helpful, and I hope to see you soon.